Hey everybody, my name's Rennie. I'm one of the fourth year chief residents here at USF PM&R. I'm joined with one of my co-chiefs, Daniel Bobbender. We're going to talk a little bit about USF, and we probably won't take all 20 minutes, so we'll have plenty of time for questions at the end, and we're happy to answer any of those. So again, we're the University of South Florida, PM&R, located in Tampa, Florida. We are a categorical program. Our most We are four residents per year. Our most recent class of interns was our first class to have four. Prior to that, it was three of us. First PM&R program here in Florida, and we're an awesome program. I guess I'm a little biased, but I wouldn't change my decision to come here whatsoever, or what. I guess their decision to have me too. I'll take that. But we're a great program. Tons of diverse training and fellowship opportunities that we can talk about. On top of what we have in regards to our training and residency. In-house, we also have pain fellowships. We have a spinal cord fellowship that are all things that are available to us. And that we work closely with if those are things you're interested in. These pictures are a little bit old. The top pictures are last group. For some reason, it's been weirdly difficult to get all of our residents in the same place to take an updated picture. It doesn't help that two of our residents recently had children, but this is what we got. And then the bottom picture is our current twos, and then again we have our most recent intern class was our first class of four. Dr. McCarthy, Marissa McCarthy is our program director. I was just talking to a few of our residents earlier, and I said, honestly, like coming here, just having Dr. McCarthy in your corner is worth it, regardless of anything else. She's great. She's so well connected, not only here in Tampa, but just across the country. And when it comes to into the field of PM&R, she can, move mountains, and she will move mountains for you if there's anything that you want in regards to your training. Our program coordinator is Sharina. She's also great. If you have any questions about the program, whether it be coming in for a visit, shadowing, doing a rotation here, she's the person to get in contact with. She's absolutely amazing, very responsive, and she'll help you out as best as she can. Some of our clinical sites. So our main clinical site is the James A. Haley VA Hospital. It's where we're kind of centrally located, where most of our inpatient rotations are going to be, like our gen rehab, spinal cord, traumatic brain injury rotations. So we're there quite a bit. We're also at Tampa General Hospital, right down the street. We also are at Tampa General Rehab Hospital, again, two different hospitals, TJH Main and then TJH Rehab Hospital for inpatient rehab. We do a lot of rotations, mostly pain medicine rotations and palliative care at Moffitt Cancer Center. And then we also have our CAMELS lab, our Center for Advanced Medical Learning and Simulation, where we do mostly like ultrasound workshops on cadavers, whether it be diagnostic or interventional radiology and kind of thing, ultrasound. Here's just a sample of our schedule as well. I won't go through the whole thing in depth because then we'll be here for a lot longer than 20 minutes. But your intern year here, it's a really great intern year. What I love about it is you do get your pretty robust experience with your internal medicine wards, primarily at the VA. But a lot of the other rotations, I guess your quote unquote elective rotations, all very PM&R adjacent. We have our orthopedics rotation where we do primarily like peripheral joint injections. So getting the familiarity with a needle in your hand, that will go a long way later on. We have our neurology, obviously the connection there with PM&R. Infectious disease, managing wounds, specifically when it comes to our SCI patients, is extremely helpful, and then rheumatology as well. And then we have our ER and family medicine rotations. We also do a specific SCI ventilator unit rotation, which is also awesome. And then from there on, it's kind of your main PM&R related rotations, your SCI, your TBI, polytrauma, and gen rehab primarily during your second year here, with a little bit of EMG and MSK mixed in. Again, we go to Moffitt for palliative care, where we learn about just like managing opioids, mostly pain, but it's a little bit, but it's more than that, obviously, with a lot of these cancer patients as well. Just their symptomatology when it comes to keeping make sure that they're comfortable while they're going through this process. We also hang out with Dr. McCarthy at the concussion clinic as well. Third and fourth year, we start to branch out a little more in regards to not being at the VA as much. You'll do a lot more consults, a lot of inpatient work, peds at Tampa General and Tampa General Rehab. You'll do a neuro-oncology rotation with Dr. Tran. He's like absolutely brilliant neurosurgeon. Most of what he says goes over my head, but it's just a great experience to hang out with him. Another guy that's really good to have in your corner, and as well as our interventional pain rotations third year. This third and fourth year is when we start to get into our interventional pain stuff. And then a lot of it is things that you have seen, will have seen during your second year as well. But again, it's a really good time here. Um, Going into some of our sites, so James A. Haley VA Hospital, again, this is kind of your primary, well, you'll spend quite a bit of time during your time at USF. We have our TBI unit, one of five facilities in the country designed to provide intensive rehab for vets and our active duties. Um, Patients. We do again our kind of our main gen rehab with Dr. Stanley. It's a lot of ortho, knees, hips, amputees, so a lot of gait training as well. Our SCI unit, we have a absolutely amazing SCI unit. Our attending Dr. Mendelson's phenomenal. Um, and then our TBI unit. And then this is a few things that are available to our patients here when it comes to their rehab, the VR, vestibular, sports, drive training. We have the pool, which is awesome. Our patients love the pool. And then you can see some pictures here. That rock wall might be the only time I've ever seen someone on that rock wall. For some reason, like no one ever uses it, but it's there. So let's see. Next slide. Okay. Again, just some more pictures of the VA, our main street here on the left, and then just some of the therapy rooms. TGH, this is the like really the main hospital out here in Tampa. It's a private nonprofit hospital, level one trauma center. It's consistently ranked as one of the best hospitals in Florida. It's a great place to train. One of five burn centers in Florida. Um, on top of just everything else that they provide. Um, we do consults here, peds here, primarily with Dr. Battis, who's been in the business for a crazy amount of time, and then Dr. Kornberg, who's just one of those physicians that you kind of like want to be like one of those like just really role model S physicians. He's absolutely amazing. I'm with him right now actually on peds, but that's TGH. And then our TGH Kindred Inpatient Rehab Hospital, it's a separate facility just down the street from TGH Main. You'll do, as of now, you'll do 3 months of inpatient rehab here, 1 month in your first year, and then, or sorry, 1 month in your second year, and then two in your third year. Um, with the R&E group there. Again, it's a brand new facility. It's a beautiful facility. All the therapists there are absolutely amazing. You have everything you could possibly need to take care of your patients here. And it's since a lot of our inpatient rotations are primarily at the VA, this is a good experience to see what things look like outside of the public government sector, more in the private world. And then Moffitt Cancer Center, again, it's consistently ranked as one of the top cancer centers in the country. Here we do a lot of our interventional pain. Again, I talked about Dr. Tran and his neurosurgery rotation, and then palliative care rotations. Again, a great place to learn. There are residents, I am residents there as well. So they're used to having residents and teaching. And again, it's a great place. We're lucky to be able to rotate here. And then I'll bring it over to Dan.
Hey, how's it going, everyone? Dan Bavender, one of the PGY4s, co-chiefs with Rennie over here at USF. So, I mean, he kind of already touched on camels. This is like it's a huge building downtown that is just a giant simulation lab, basically. We mainly use it for ultrasound guided injections, diagnostic ultrasound. We typically have 1, 2 clinics there a year, where we have a couple of our ultrasound experts come in and teach us. Yeah, that's about it for that. Next slide, Rini, please. So musculoskeletal experience. I mean, we get a lot. I would say it's robust to say the least. I was checking numbers earlier today just so I, could mention. I think with ultrasound guided and blind injections, I'm over like 400 coming into fourth year. I'm on an ultrasound guided injection month now with Dr. Linto, and the guy's a wizard. He just joined us last year, and the guy's brain just works different. He's a diagnostic ultrasound guru. So yeah, some shockwave as well, which mainly for like plantar fascia. So we use that for PRP. I mean, one of our attendings, Dr. Abisi, he's got to be like top 10 in the country for number of PRP injections a year. I couldn't even tell you the amount of PRP injections that I've done or that we do every month. It's honestly incredible, and that's something that's just super nice being at the VA, that we don't have to worry about insurance or private pay from that standpoint. So a lot of shoulders, hips, knees, a lot of rotator cuffs, tennis elbow. I would say like kind of are the main ones that we see the most of. Steroids, obviously, viscosupplementation, hyaluronic acid stuff. Plenty of that. I think that's the main stuff from a ultrasound standpoint. Go ahead, Rennie. Okay, so kind of our call. We don't really have PGY1. It talks about like long call while internal medicine. That's like kind of usual medicine. That's not really call. That's like you're admitting patients. I wouldn't call it call necessarily. They just kind of call it that. Our actual like PM&R call starts second year. I think right now there's only 3. It's going to be 4 next year, so it'll go down even. I think right now every 2 gets around 70 something days combined. Like that's weekends, weeknights, holidays, everything combined. It drops pretty significantly to like into the 30s PGY 3 year, and then PGY 4s. It's just 1 weekday call a month. Starts at 4:30, goes to 8. It's all home call. I've only ever gone into the hospital once, and looking back, I didn't even need to do that. I could have, sufficed with a picture or something. So it's very rare that we actually have to go in. Anything major is going on, like our rehab hospitals that we're covering like chin rehab, TBI, overnight, and then a couple smaller units. If anything major is going on, they just get transferred to the hospital. So it's not like super high stress. It's actually pretty chill. Didactics Thursday afternoons every week, from 12 to 4-ish. Lecturers from all over the place. I don't want to go through this too much. I see that we're kind of down to the last 5 minutes. So one thing to really point out is our staff. Everyone is incredible. Like I literally do not have a single attending that I don't like working with. Just like it says, 1-to-1 ratio, and then even then, like all the attendings don't necessarily rely on us. So if we ever need to take vacation or sick days or whatever, we're never pressured or felt like we're a piece of crap for leaving them on their own. That's like totally fine. They don't care at all. So that's a really nice feeling, and I can say it's not the case at all programs. So something to keep an eye out for. Rennie kind of already touched on the fellowships, so let's move forward. So as you can see, especially like recently, we've been a lot more interventional pain heavy. We have a really good relationship with our interventional pain program. We basically do half of the interventional pain the USF Interventional Pain Fellowship in our residency. We do 5 months, 3 months of Moffitt, and then 2 months of a private practice. So we're with the fellows during that. So basically, like I said, we have a very good relationship with them. So I'm trying to think. I think even back to 2022, all of these interventional pains you see is USF interventional pain. No one left to go elsewhere. We get incredible training, so there's no reason to go elsewhere, to be honest. And then, some of the regular rehab stuff mixed in. Go ahead, Rennie. Pretty competitive salary. I mean, it's gone up pretty significantly recently with the price of living going up in Tampa. So like this here, you can see it kind of goes up by a couple grand each year. But even then, every year they've been like increasing those by like a few percentage points. I think like between first and second year, it went up like 7% or something crazy. So we have a good like residency advisory committee that really sticks up for us when it comes to cost of living, and so that's really nice. Our health insurance is changing, so hard to say what that's going to be coming soon. It's going to be through like the state of Florida as opposed to through USF. So I've heard it's not bad, but I don't know what it is yet, to be completely honest. TERP program, everyone's automatically enrolled, and I think it ends up being roughly like 30K when you leave in a retirement plan, which is pretty sweet. I don't know what the employee assistant program is. Next slide, Franny. Danielle turned her camera on. So life in Tampa, born and raised in Tampa. So if you have any questions about this, let me know. Big highlights, Gasparilla. It's like, mini Mardi Gras. It's a lot of fun. But lots of outdoor stuff, lots of sports. Go ahead, Rennie. I think, is that the last? There might be one more. This is ACGME rules, not necessarily USF rules, but 10 patients as an intern. And here at USF, they have an eight patient cap, so it's even better. 14 patients as a resident. I would be hard pressed to say that I get too close to that. I mean, TGRH, the TGH rehab, we get pretty close. But at any point, I never felt like on an island or like that I was overwhelmed or anything like that. There's plenty of support, including like the upper level residents, senior residents.
Minutes remaining.
Thank you, Danielle. 14 patients. Yeah, so we'll move on from that. So procedures, we knock all of these like way out of the park. It's not even close. The only one that we get even close to is EMG, and that's by design because EMG is not our favorite thing in the world. So most of us kind of just scrape over the 200 and, move on with our lives. All of these other ones, I mean, I'm literally not even close. We've got to be, especially like ultrasound, axial, peripheral joint, we've got to be like in the 95th percentile for programs. Time off is honestly ridiculous. 20 days vacation, 15 sick, 5 conference. I mean, that's 40 days of vacation. That's not including weekends. That's like literally 8 weeks of vacation. Moonlighting is available. Oh yeah, and then we go to the board review thing. Yep. All right. I think that's the last slide. Oh, our puppies. Top left one up here, that's one of mine. And then the group of 3 down at the bottom right, those 3 are mine. And 2 golden doodles and a pound hound. They're the best. Rennie doesn't have any dogs, so don't ask him about dogs. He's only got cats. Just throwing a little shade. All right. Any questions, definitely feel free to reach out. I would say the highlight of our program is we're a very tight-knit group, always doing stuff together. I think all of us we're all trying to get to, I can never remember, the one in Puerto Rico in February.
AAP.
AAP, we're all trying to get to that in February. A lot of us going to pain, so a lot of us are trying to go to ASIP in New Orleans. You see us out there, hit us up. We'll be there. And then I guess we'll be at FS PM&R in September, a couple weeks. Me and Ren will be presenting. So make sure you clap.
Thank you both for this presentation. This is great.